In the section entitled Expertise and Expert Performance, it's alluded to that the expert musicians, that elite athletes, that medical authorities of some sort, there's a common denominator found in their behaviors. You mentioned it with Dr. Erickson's comments, and he's in the forward. He writes the forward for it. Share a little bit more on maybe an illustration that a reader might find in this section.
So the common element that is responsible for improved outcomes across a variety of human domains is this activity known as deliberate practice. And the real definition is to reach for a performance objective that's just beyond your current ability. Now, most of us, when we hear the word practice, we think of what our parents told us to do with the piano. You would sit there for a certain length of time and you would repeat over and over and over the same song. Erickson would call that purposeful practice, which is about achieving competence. You achieve a certain standard of performance. And there's nothing wrong with that. That's the way most of us learn to drive our cars. At first, you were hyper aware of everything you did and the signals and how close you were to the car ahead of you, etc. Over time, those behaviors become automatic and we achieve a certain level of competence. Now, here's what most drivers think. The average driver thinks they're better than 80% of other drivers on the road. That's exactly the same figure of what therapists believe. They see themselves. I'm not making this up. We have research studies, cross-cultural research studies that say the same thing. Average therapist thinks they're better than 80% of their peers to whom they're compared. That's because their behaviors become automatic. And that's a good thing when behavior comes automatic, because then we can devote our attention to other things that we need to learn. The problem is we don't tend to do that with our free time. Instead, we notice when our current way of thinking seems to work. That reinforces the perception and our confidence that we're doing really well at it. By contrast, deliberate practice challenges that automaticity. It shakes you. It says you have to become conscious again of everything you're doing in order to optimize your performance by reaching for something you're presently not able to do. That might mean taking a defensive driving course or learning to drive at speed in different weather conditions. It would also mean there's probably needs to be somebody sitting next to you in the passenger seat coaching you. Here's how you approach this curve at this speed under these weather conditions. And you would then have to repeat it over and over until you achieve a new level of mastery. And it's that which has been lacking among the training programs in psychotherapy or in psychological care. Instead, the focus is entirely on competence. In fact, all of the ethical codes for mental health professionals simply say, quote, to practice within the boundaries and limits of your competence. When people bring this up to me, I sometimes say, yeah, that's what killed George Washington. And they say, what are you talking about? It killed George Washington. I say, he was treated by a very competent bloodletter. So the thing that they did was disconnected from the outcomes. It was actually associated with negative outcomes. But if the patient lived, what did that do? It reinforced our confidence in the procedure. If they died, well, I guess they were just too sick. Some people are beyond help. This deliberate practice focus, by focusing on the individual, measuring your results and identifying those small shortcomings, gives us an opportunity to address what we call non-random errors in our performance, things that are occurring over and over that may limit our effectiveness or may prevent us from becoming more effective.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.